A recent survey puts hospital billing practices into perspective in the state. A nonprofit claims only 20% of Alabama hospitals follow those regulations. News 4's Michaela Simmons joins us live tonight in the studio. Michaela, what does this mean for patients?
Kinsley, this means out of the 30 hospitals surveyed, only 6 are compliant with federal transparency requirements. Only those 6 hospitals revealed their prices for prospective patients before having procedures.
Who would want to pay more than $3,000 to $7,000 for an MRI when you know you could get it all in and read by a great radiologist for $300?
That's why Patient Rights Advocate released a report showing Alabama hospitals that are in compliance with price transparency. Those show patients prices of various medical procedures so they can find what's best for them.
Because prices give patients also remedy and recourse. This is huge, especially in these times that are so inflationary. And look, Michaela, almost everyone has their own story of an overcharge that they received in a medical bill, either for themselves or their family member.
Flowers Hospital and Medical Center Enterprise complied. Fisher says it's great for patients to be able to compare prices with different hospitals.
We applaud Flowers Health System, and we also applaud the Medical Center and Enterprise, right?
Yeah.
Because they both are posting all of their prices by every single code and procedural name, and by every single insurance carrier and plan that they offer in their facility. The other thing they do is show the discounted cash price if somebody just wanted to pay cash.
Fisher says she wants to continue being an advocate for patients, and there is more work to be done.
And enough is enough, because as long as hospitals and insurance companies hide their prices, they can charge whatever they want. Prices provide integrity, accountability, a market that can function with competition and consumer choice, and benefit all consumers.
Flowers Hospital commented and said, quote, Flowers Hospital has resources in place to help patients understand and meet their financial responsibility, and we have worked diligently to be sure information posted on our website conforms with federal price transparency requirements. End quote, Kinsley.
Michaela Simmons, thank you for that report. If Alabama reaches 60% compliance, this organization hopes to develop an easy search engine tool to show prices for procedures.